What's up, you guys? My name is Miguel, here to give you your daily dose of radiation. In today's video, we are covering the difference between having the automatic technique, the default, versus the actual setting a technique, how different it plays. So I work at an ER, and the majority of the nighttime we do everything portable, but we also have like the main X-ray consoles. When I was a student, because you don't have that much knowledge of the equipment that is, because I mean you're going to different places you don't know, certain equipment works better fixed. Like you can use, a set, like you can set a technique, set stuff to get better images compared to just the default. As a student, majority of the times you just shoot it under the default because you just don't know and you're afraid to overshoot patients. But if you're able to set a technique, you can get way better images and way better things and reduce radiation, reduce exposure, there's so many things, and it ultimately make you way better tech. Majority of the times, most places have old equipment, they have their little specific bugs or certain things that will cause an image if you shoot it under the default technique, especially like T-spines, bigger patients. There's been times where, and also depending on like if you shoot it on the wall bucky versus the table bucky, like so many times there's been L spines we shot and standing up, and then we'll lay them down, the image is probably like 30% better, and you're just like, or even like we'll shoot it, let's say the student shot the patient an L spine, just the default large technique or whatever, and then we'll see like one of the veteran techs be like, okay, let me set a technique, and then you shoot it, and then you can just tell this is like completely way better. And then like sometimes you have to explain to the student that you have to set techniques, and obviously they don't know some of the times the techniques, because like certain machines you have to shoot it hotter or more kVp, less, like everything comes with time, but like it makes a difference. I would say, especially if you're a younger tech, it took me a few months just to understand how to make the adjustments accordingly, but it helps so much. I would recommend anyone, if you're still new to the game of doing X-rays and you're still shooting under the default, and let's say you're shooting a T-spine and you just shoot it and it's not good, you shoot it again, you column it, and it's still not good, go over there and set a technique. Look at the default, because like majority of the times with the default, it'll tell you, is it underexposed, is it overexposed, is it underexposed, and then if you shoot it and you adjust a little bit, it's all about adjustment, and all about, sometimes maybe something with the tube wasn't lined up, but like if you're willing to set a technique, majority of the times you can get way better pictures. So that is something I would recommend anyone doing. I know for a little bit I was afraid to kind of do it because I wasn't aware, but for some of the stuff, it's way better. All the T-spines, L spines, C spines, majority of the spines, because it's more thicker. Like chest, like majority of the times you can just leave it on default and just bump it up a little bit, your kVp or mass, or shoot it under a grid, and you'll be fine. But like I would say some of the other body parts, I want to say, especially like when patients get hardware and stuff starts getting burnt out, then you'll just have to start using setting a technique just to compensate, because if not, the hardware will absorb all the radiation and the bone will be burnt out, and you won't be able to get a good image. I mean, sometimes because the patients are really skinny and old, even setting a technique, the image will still not look good just because of all the hardware the patient has. So that's something with time, obviously. I mean, regardless of where you work, if you have a fellow veteran tech, I would ask and get recommendations, because if they've been there long enough and the same equipment, they've probably already messed with it and they can give you so many hints or just helpful advice. There's been times where I was a younger tech, and I was thankful enough some of the veteran techs showed me, like, hey, if you use this, or hey, if you're using, like, sometimes it can be the same equipment. It can be the same portable machine, the same console. It just, this one in particular, maybe because of how it's worn out or the stuff they swapped out over years, certain ones shoot it harder. Certain ones more KVP. Certain ones, the default will be like super darker contrast. You have to, it is truly something that it just takes time, and it just takes, like, you just have to play with it and just get better with it. I know it's dangerous because obviously you're dealing with radiation, but like some of it, like I've shot in so many patients, and they'll be the same build. Like you'll see the same, almost everyone falls into different categories as far as like their body habitus. If you've been doing it long enough, you can just see someone and you're like, yeah, he probably has long lungs, or he probably has this and that, and you can kind of compensate and adjust with over time. You can like pay attention and allow you to be able to set your technique accordingly. Certain patients, you'll see them and you're like, if I shoot it with more KVP or with more mass or more whatever, it could like over penetrate, under penetrate, burn it out. Everything just takes time and learning your equipment, and it's something that it just takes time. I mean, there's time, especially the bigger patients, is when all that knowledge, and sometimes even the bigger patients, and I'm talking about like 500, 600, like the big ones where you just digging for bones, as we call it, will truly test both your equipment and your technique skills. Because sometimes you'll be up there and you're like beep, 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 like raising the technique, and you just shoot it, and then you're like, I can't see nothing. Like it looks so grainy and so bad, and you're just like, it's just you're just playing around sometimes. Obviously, certain equipment has a like weight limit, and these patients sometimes be pushing that limit to the brim, or like the patient will be like exceeding the limit. They're like, can you do this, can you do that? And you'll have to explain to them, like, if I shoot it, you're not gonna be like, you won't see nothing. Like sometimes some of the doctors don't understand that it's not that you just don't want to do it because they're big. Sometimes you're like, this image is gonna look like terrible, like undiagnosable. Like, I'm just doing this, just shoot them up, and you're not gonna see nothing. Certain of the veteran doctors understand. At some point, they're like, you know what, we'll just do CAT scan instead. Maybe that'll do better. Other ones, you'll just, regardless of how much technique you say, this is not going to be good. So, it's been your boy Miguel. See you on the next one.